Hi, everybody. It's Karen Anderson with Aortic for this week's Week in Review. Now, if you're new to the channel, to Ahtv, our Week in Review is basically just a recap of everything that we posted on our social media platforms last week. Kind of just gives you guys a chance to put some comments if you want down below here on our YouTube channel, and just offers another way for you to become more aware, educated, and creating that deep sense of awareness that only Aortic Hope can do. So what I'm going to ask you to do is please click like, please click share, and at the, subscribe, sorry, so that you're notified every time we go live, and click share at the end because someone will really find this to be quite knowledgeable. Before we get started, so that I don't forget, I do want to give a very big shout out to our sponsors. Last week, our sponsors were Edwards Life Sciences. They've been such a huge supporter of ours, helping us not only this time around with sponsoring 2026's Week in Reviews, but also being such wonderful donors when it comes time to us to publish and produce our patient guides. In addition, Cook Medical, they're also a sponsor for 2026 of these Week in Reviews. And I'm going to give a big shout out to Heart Valve Voice US for sponsoring as well. And this is a great time to do that because it is Heart Valve Disease Awareness Month. So let's get right into what we're going to be talking about for this week. Let me go ahead and share my screen here, and away we go. Okay, let's get started with our Medical Monday. So this particular week was about mechanical versus bioprosthetic valves. As you know, we've been discussing everything that has to do with the aortic valve for this very important month. I mean, there's so many things going on this month, between it being Black History Month and Marfan awareness and just heart disease and heart valve. There's a lot going on. So let's talk a little bit about the different options that you have to choose when it comes time to replace your valve. And I just did that. I just did that 16 weeks ago. Yeah. Okay. So we have biological versus mechanical. And what patients with aortic disease really need to know is that one of the biggest decisions you might face is, what type of replacement valve do you even want? And it can really feel very overwhelming. It was even overwhelming for me. And I'm one of the founders of Aortic Hope. So the organization really came to be after I had my aortic dissection. And so even over the years, as knowledgeable as I am, I was very, very, very overwhelmed. And it kind of breaks down in plain language to a lot of the information we're going to share with you today. And this really should help you walk into your appointments feeling a lot more confident. So what does the aortic valve even do? It is the door that lets the blood leave your heart and flow into the aorta, which takes all that oxygenated rich blood throughout your body. And if it becomes too tight of a door, that's called stenosis. But if it becomes a leaky or floppy or not closing all the way door, that is called regurgitation. And in both cases, your heart is going to have to work harder. And if it becomes severe on either of these, your doctor might recommend replacing it. So when that time comes, there are mainly two options available for you. That would be mechanical or bioprosthetic, otherwise known as tissue valves. Both of these valves will save lives, and the right choice really depends on your health, your age, and your lifestyle. So let's talk a little bit about mechanical valves, which are built to last. They're made from very strong materials like carbon and metal. And what patients really seem to like about them is that they're very durable, and they often will last a lifetime. There's a much lower chance that you're going to need another valve surgery. Everybody says it's like a one and done. But here's some things that you have to consider, because there are some trade-offs. So when you choose a mechanical valve, you're going to have to be on blood thinners like warfarin, otherwise known as Coumadin, and that's going to be for life. That's going to be for life. And there's a lot of different reasons behind the mechanics of a mechanical valve as to why we want to keep you on blood thinners. It's going to require that you have routine blood tests to monitor certain levels regarding the thinning of your blood, and you will have a higher risk of bleeding and bruising. And also, some people can hear a faint clicking sound. I think faint is in the ear of the beholder, because some people say that sound can actually be quite loud and others say it is faint. And some people don't even notice it and they might find it heartwarming to hear that sound. For younger patients, durability is a very big advantage. And many people choose mechanical valves with the specific goal of avoiding a repeat surgery later. Okay, so a couple different things to think about. Now, bioprosthetic or tissue valves, here's some of the things you need to know. They're more natural, okay, because these valves are made from animal tissue, typically a cow, which is called bovine, or a pig, which is porcine, and they've been specially treated and configured for medical use. And what patients really like about being on these is you don't have to be on such a strong blood thinner. There is a much lower risk of bleeding issues because you don't have to be in the blood thinners. There is no valve clicking sound, and I can attest to that. I hear nothing. It's silent. And there's fewer medical restrictions. And also, just to mention, when you're on mechanical, you have to watch some of your dietary issues. So leafy greens, certain things, alcohol, certain things will, I guess, counteract the blood thinning things of the medications. So there's a lot that I don't know a lot about that because I don't have it. And these are great questions to ask your physician. So there's a dietary component as well for mechanical valves, but there isn't one for bioprosthetic. Here's some of the trade-offs, okay? They don't last forever, not as of today. Okay, so valves that are going in today in 2026 do not last forever. They could wear out in 10 or as long as 20 years. And so younger patients are probably going to need a procedure later in life. But the good news is that many failing tissue valves can now be treated with less invasive procedures called valve in valve. And it really does depend on your case, which means instead of having to be re-cut open again, like you do in open heart surgery, they can go endovascularly through your groin, or I don't know, maybe through a wrist. I'm not a doctor. I don't know. But it's less invasive and they can just kind of deploy a valve right in place of the valve that you have. This is kind of how doctors might help you decide. There is no one best valve option. It's not a one stop or one size fits all for people. It's really part of the acing your healthcare journey that we talk about all the time. It's part of advocating, communicating, and educating. It is a two-way street for success, and this too is a shared decision-making experience between you and your heart team as well as your family. So what doctors put into consideration would be your age. It might be your other medical conditions you might have. It could be your personal bleeding risk factors, your ability to take blood thinners. If you have plans to have a baby in the future, that's going to be taken into consideration. And personal preference. Do you want to hear clicking? Do you not? There's a lot of things that go into this. And also your willingness to have future heart surgery. I made it very clear. I don't ever want to have my chest cracked open. I don't ever, never. But I still went bioprosthetic because I also did not want to be on that blood thinner and I did not want to hear any sounds. And I liked the valve in valve concept in the future because every year something new technologically is being born in the medical community. So who knows what's going to be available to us in another 5-10 years. In addition to what the doctor is taking into consideration, your lifestyle matters too. Here's some real life factors that patients will often ask questions about. Travel. If you're somebody who likes to travel and you have an active lifestyle, mechanical valves are fine. They're fine. But you really have to manage your blood thinner and the monitoring that goes on by taking these blood thinners. Contact sports. Tissue valves might be safer than having a mechanical valve due to the risk of being on blood thinners. If you're thinking about pregnancy, tissue valves are usually going to be more preferred to avoid complex anticoagulation therapy. Medication access. Blood thinners require constant and consistent follow-up and lab access. So if you're not in a position to be able to get that lab access and that testing, this is another consideration, something to think about. So here's just some of the questions you can ask your surgeon. And I do suggest maybe printing this off. And this is going to be part of something we're going to announce in a bigger format, but as an addendum to acing your healthcare journey, we have created the patient surgical plan. So this is part of your surgical plan, would be asking questions like, how long will each valve last for someone my age? What medications am I going to need, and what would be my bleeding risks? Would I qualify later in life for valve and valve surgery? And what would most patients like me choose? I like to ask, if I was your sister, I don't say mother, if I was your sister, much younger sister, what would you be advising me based upon what you've come to know about me? So here's a summary from Samantha, who's one of our med students. Here's the summary. Mechanical valves, they're going to pretty much last forever, but they require lifelong blood thinning use. And then tissue valves avoid that blood thinning, but they might need a replacement, right? So both are really excellent life-saving options. The right valve is the one that fits your medical needs and your lifestyle and what you're comfortable with. So if you or a loved one are navigating aortic disease, just know you're not alone, okay? These decisions are big. They're really big, but with the right information and care team, you can make the choice that you really have decided is going to be right for you. Don't forget about that. This is all part of acing your healthcare journey and the importance of having that open communication, educating your physician. It all equals advocating for yourself. And this is part of what your physician should be doing equally with you. Again, this is not a power struggle. It's all about power balance, and it's a two-way street for success. And that's your Medical Monday. Okay, let's get started on Topic Tuesday. We're going to just go right into more information about these valves. So if you've been told that you need aortic valve surgery, and I have a huge video about my personal journey with this, you're probably going to hear the term SAVR, not TAVR, SAVR. And that means surgical aortic valve replacement. Kind of sounds intimidating, but SAVR, if I'm even saying it right, I might not be saying it right. It's a well-established operation that has helped millions of people live longer, have healthier lives. So let's kind of break down what this really actually is and why surgical is performed. So again, we're going to reiterate, what does that aortic valve do? And it sits again between the heart and the aorta. Okay, there's a valve. It's the door. It's the doorway. And it really helps keep the blood flowing in one specific direction, which is what's going to allow the blood to go out of the heart and infiltrate the entire body. Okay. And over time, as we talked about, this valve can become very narrowed, which means stenosis, or it becomes leaky, which means regurgitation. But what happens is the heart actually has to work harder in both of these scenarios to pump the blood to the body, which can lead to symptoms like shortness of breath, a little bit of chest pain, fatigue, or even possibly some fainting. So let's talk about what the surgical aortic valve replacement surgery is all about. So that's open heart surgery. Oh gosh, sounds scary, right? Look, it's not pleasant. Nobody signs up to have their chest cracked open, but gosh, it gives the doctor the most access to everything, right? I mean, it gives the physician a really good field to be able to remove that damaged valve, take a look at anything that's going on around it, and replace it with a new one. And the new valve, as we talked about, can be mechanical, made from durable materials, right, that can last decades or for the rest of your life, but requires blood thinners, or they can replace it with a bioprosthetic tissue, cow or pig. Typically don't require any long-term blood thinner use, but can wear out over time, right? So your age, your lifestyle, which we talked about, and other medical conditions all play a role in deciding which type is best for you. So let's take a look at this, because this is really interesting. Here's a mechanical valve, and it sits right here. This is where your aortic valve is, and allows the blood to come from the heart and go up into the ascending aorta, around that arch, and back down towards the descending, which takes all that blood to the body. Mechanical, it actually only has 2 leaflet areas, right? And we're used to seeing 3 leaflets in a valve that is normal, and or someone that was not born with congenital heart defect, like your bicuspid valve. So this is mechanical, looks pretty mechanical, right? And this is biologic, which kind of looks more like tissue, right? Okay, so when would open heart surgery be recommended? Well, when it comes to having your aortic valve replaced, surgical is one of a couple like different options, and surgical is usually recommended when the aortic valve is severely diseased and is causing a lot of symptoms. The valve could be having a problem and isn't operating correctly and is affecting your heart function. Other heart surgery, like if you're going to need bypass or something like that, it's a good time just to do it all at one time, which was the same thing in my case. Because I was having the valve replaced, I had my graft and my ascending aorta replaced, and I had a bypass done as well. There are less invasive options like TAVR, transcatheter aortic valve repair, that exists, but the SAVR is really, it's the gold standard. It's the one that we don't like as patients, but I kind of think that the doctors, I kind of think they like it, right? So we might not like it, but the physicians will like it. And it's really used a lot when it comes to younger patients, lower risk individuals, and those needing an additional heart repair. So if it's your second, it's probably going to end up being open. So let's talk about recovery and life after a surgical aortic valve repair. So recovery usually involves several days in the hospital. Okay, it just does, and a few weeks at home. I was in the hospital about 7 or 8 days, recovering at my mom's for 8 weeks. I'm going into week 16 now. Most patients notice a lot of improvements in energy, breathing, and exercise tolerance once they've healed. What does healed mean? Healed means very different things to different people. You're still going to have long-term follow-up when it comes to regular checkups, heart imaging, and for some valve types, some medication management. Here's the bottom line. A surgical valve replacement is time-tested. It's an effective treatment for serious aortic valve disease. And while the idea of open heart surgery can feel overwhelming, many patients go on to enjoy a much better quality of life after recovery because you're going to lose all those symptoms. As always, the best approach is personalized. So talk to your surgical team about your specific situation, your anatomy, your goals, and your long-term outlook. All right, this was a great post from Ani, one of our medical students, and I'm excited to see what's coming up this next week. So hopefully this resonated with some of you and makes it a little bit less scary. Remember to ask those questions of your own personal physician. And that's your topic Tuesday. Okay, we are moving right along to a great day that happens in February, and that's Random Acts of Kindness Day. So, perfect time to spread the kindness, show your love. It's a beautiful reminder that even the smallest gesture can really make a difference. I tell you what, especially with a lot of ruckus and noise that's out there in the world, when you are internally dealing with a lot of turmoil, sometimes the best thing that you can do is just go be kind to someone else, right? Hold the door. Hold the door for someone. Send a special text message just because. I know my very good friend and I, we send memes all the time, just early in the morning. They're pretty, the language is very colorful, but it's always just about how wonderful we think the other person is as a friend or something like that. And mailing cards. You know, we don't get snail mail anymore. These kids, I don't even think kids today know how to properly address a card. Get email, very powerful. Pay the coffee forward, right? So sometimes if I'm in line to get a drink, I'll ask, hey, what's the bill of the person behind me? And depending on the total, I might just pay for it. There's nothing better than seeing the reaction on their face when they pull up and someone says, oh, it's already been taken care of, right? It's kind of fun. And if someone that you notice hasn't been around much online on the community, check in on them. Check in on them. We don't really know what people are going through. And kindness, it doesn't have to be grand and massive to be powerful. Sometimes the littlest things mean the most to somebody, especially in the aortic community, where a simple, hey, how are you doing? I mean, it can really just mean everything to someone. And living with aortic disease really teaches us something special, that tomorrow is not guaranteed, but compassion is always
available. So whether it's Random Acts of Kindness Day or any day for that matter, let's flood timelines. Let's let people know that we're thinking of them. Real life encouragement, grace, and support. That's it. It goes a long way. It really does. When we lift each other up, our hearts really do grow stronger. So that was Random Acts of Kindness Day. Okay. February, we have an ongoing fundraiser for the entire month, and typically we just have the first Friday fundraiser, but this is a February fundraiser. It's for our belt covers that are typically $18 domestically. Now, you guys internationally have to stay at 23. It's just too expensive. I'm so sorry. But your belts come in basically two different colors, black or red. They're going to look a little different from this picture, and we're down to 2 sayings. So these show our old style with a couple different sayings on it, but they're down to 2 sayings, medical alert or aortic disease. Look, they are simple, they are compact, and they are life-saving ASAP. Why? Because we know awareness saves aortas, period. They are Velcro closure, so they wrap around your seatbelt and they velcro shut. You can even put it around a leash for a dog. You can put it on a backpack strap, pocketbook strap. It's really not, I mean, anything that you can wrap something around, you can wrap it around, okay? And it's really going to provide instant medical alert recognition because there is the universal symbol for medical stuff on the belt. So whether you have aortic disease or another medical condition, this belt cover might really be something you should consider. Inside the pocket is inside there is a pocket with a clear window and a card that you can write any of your medication allergies on, or what you're taking, any other medical conditions, doctor's numbers, your in case of emergency number, et cetera. That all goes inside. So again, for the month of February, they are $14 for the community that is domestic to the United States. Excuse me, or $23 internationally. That includes shipping. Okay, so they are, again, designed by the community for the community. There is a link to an order form on our blog post, but if you go to our Hope Shops page, you will see that also there. Don't delay, grab this swag today, replace your old belts, start a conversation about aortic disease ASAP. Okay, let's move on. All right, we wanted to make sure that you are reminded that we have a bunch of monthly support group meetings. And what I think sets us apart in the support arena is that our support groups are led and moderated by other patients or caregivers or people that have lost loved ones. And that's very important because a lot of us have been to support group meetings that are run by the nursing staff or the medical community, and that's great. But there's something different about having someone just like you, who not only talks the talk, but walks the walk, who knows what it feels like to have a chest tube come out, or who knows what it feels like to have to go through the strain of determining what kind of valve you want to choose for surgery. That's very different. When medical community talks to us, they don't know what it feels like, but we do. So we have vetted our moderators, and really their job is to just make sure the conversation's flowing. We do not give medical advice, but what we do is we share our life experiences. And so we have them for caregivers only. And they actually happen now on the first Saturday at 10 a.m. and the third Monday at 8 p.m. Or sorry, the second Wednesday at 10 p.m. Anybody can attend the first Tuesday of every month at 12 p.m. Eastern, the second Tuesday at 10 p.m. Eastern, and the last Wednesday at 7 p.m. Eastern. We have them in Canada. We also have them in Canada for the first Wednesday at 7 p.m. And our grief meetings happen the second Tuesday at 7 p.m. every other month. So just know this, we see you. We see you, and you're not alone. When you're part of the Aortic Hope community, because aortic disease, it just doesn't affect your heart, right? Or your aorta. It can change your whole entire world. I mean, it touches your routines and your relationships and your sense of safety, and sometimes your sense of self, okay? So these aren't just meetings on a calendar. They are safe spaces filled with compassion, shared stories, quiet strength, and understanding nods. right? When words are kind of sometimes hard to find. So whether you're navigating recovery, or you're supporting someone that you love, or you're walking through grief and bereavement, there is a place for you here at Aortic Hope. You don't have to explain everything that's going on in your life. Sometimes just finding a place to listen is all that you need, and you don't have to be strong. You just have to come as you are. Just show up. Our support extends beyond borders. As I mentioned, we have meetings in Canada, bringing together all of the voices in North America in a shared mission of healing, awareness, and hope. And again, you don't need to have the perfect words. You don't need to have it all figured out. Sometimes the bravest thing you can do is show up. So from one heart to another, you are not alone. All you need to do is go to our events page here, and right at the top, we have all of our meetings listed here. Just click on the one that you're interested in. It'll take you to a form. You fill that form out, and then you will receive a link to a private Teams meeting. So download Microsoft Teams, and you're going to get a reminder moments before the meeting starts. Join whichever one fits your time frame. Okay, Survivor Series replay. This particular last Saturday, we featured our community member and friend, Kathy Jo Peterson. So Kathy Jo is quite the story to tell regarding unexpected aneurysm that was found during a separate procedure. And I'm here to tell you that she just recently had surgery about a month before I did. So she is a two-timer now. This is based on her first story. I need to get her in to do a follow-up story, but she shares her story of survival. You can click the link here or go find Survivor Series on this side, and you can watch it there. Now, look, we would like you to be a shining star in somebody's life. We want you to submit your story. We want to know everything about diagnosis. We want to know what you've been through. And we also have a follow-up series called Where Are They Now? We've been doing this since 2018. So we have a lot of stories on here of where people are now post recovery land. We want to know, like, did you get to see your kids graduate? Any weddings, getting new puppies, go back to work, run a marathon? Like, what accomplishments, what are you doing now post diagnosis or surgery from aortic disease? That's what Where Are They Now is all about. One of the things that also has set us apart in this field of doing survivor stories and follow-up series is that we don't interview anybody. We don't have set questions. We let you guys take the mic. You share your story, whether it's in written form or pre-recorded video. You set the tone and the pace. Say whatever's on your mind. Okay. So yeah, that's our replay Saturday. We have our Where Are They Now and our Survivor Series. Okay, also, we talked a lot last week about pre and post-op suggestions. There's a lot here to talk about. So whether you're heading into surgery or supporting someone who is about to, having the right questions in hand can bring a sense of clarity, confidence, peace of mind. That's why we have this ever-growing list of pre and post-op suggestions, which were built by the community for the community. Some of the other things we want to talk about before I show you the list is before surgery. Here's some of the questions you might ask, and this would be part of your patient surgical plan. Just a sneak peek, we're going to get into that. Ask what type of repair or replacement are you having done and why? I think it's important to know. Unless you're someone that doesn't want to know, ignore what I'm saying. How long is the surgery? So my family has an expectation. How long is my recovery? Generally speaking, and don't hold yourself to that, please, because if you go longer, don't feel like you're a failure. All right. If someone says, 6 to 8 weeks, but it's 16, it's okay. That's your journey. What restrictions might you have when you go home, and what symptoms would prompt you to have to call the office? Because it could be a emergency. And are you going to need cardiac rehab or any physical therapy? Those are important. And after surgery, I think it's also important to know, like, what kind of medications are you going to be prescribed and why? What's considered a safe heart rate and blood pressure? What's the ranges that you want? I think that's important as well. And when can you lift something and how much? When can you drive? When can you return to work? These are all really important questions. And what follow-up imaging, if any, will I need, and at what time? And what emotional changes are considered normal during recovery, because recovery isn't just about physical, it's mental, it's, it's very emotional too. And I've been very open and honest about my journey, and it's okay to ask about anxiety, sleep changes, or just feeling different or irritable or awkward. These are all very normal things to feel. We know that this list can always grow. So if you have a question, that you're really happy that you asked, or you wish you had asked, send it to us. Send it to us at info@aortichope.org. We'd always love to add to this list, right? Because here at Aortic Hope, we learn together, we prepare together, and we heal together. So let's get into our list just a little bit. This list is under resources, by the way, 2026 pre and post surgical suggestions shared by the community for the community. Okay, so many interesting things here to talk about, but it's strongly suggested to have a loved one or friend with you at your consultation, because you really want to have some, or pre-op appointment. You need an extra set of ears. As a patient, your mind's going to be all over the place, but to have somebody else there to ask questions for you that you talk about ahead of time, or ones that they even come up with, it's very helpful. You really could use somebody with you who cares about you in your pre-surgical appointment. Make that list of questions that we talked about. There's a lot of lists here, everything from how long before I'm extubated, meaning breathing tubes coming out, if there is one, can your loved one spend the night? There's a lot of questions here to think about. If you're somebody who becomes anxious, can you maybe have a little something before the surgery or the procedure, something that takes the edge off? I know I asked, I didn't want to be altogether present in the pre-op room waiting to be wheeled to the surgical room. I did that already with my dissection. So they gave me a little Versed and I was loopy and happy. There was a little bit of tears, but it wasn't as bad as what it would have been. Things to pack. I've been asked this question so many times over the years. Okay. The reality is you don't really need to bring anything but a charger for your phone. And even then, you don't even need to bring that, because if you're going to have open heart surgery, you're not going to want to touch your phone. I promise. There is nothing you're going to want to say to anybody. Somebody had once suggested to pack sweats. All right, if it's cool outside, sure. I personally like the idea of bringing a shirt that buttons down in the front, because you're not going to be able to put your arms over your head if you're having open heart surgery. I don't care what time of year it is. Anything that's going to have buttons in the front would be helpful and soft to your skin. I would not bring your silky pajamas or anything personal to the hospital, because there's a lot of, how should I say this? Potential for fluids, blood, chest tube fluids, other things, and you don't want to mess up your stuff, right? You don't want to mess it up. I mean, if you want to bring slippers, make sure they're not slippers that you slip into, because the last thing you need is to fall. I'm just say stick with the socks they give you that are treaded. This isn't a fashion show. Nobody's looking at you. Nobody, and I promise you're not going to care. But these are suggestions that have been made. Women, very important. Talk to the hospital. Ask them, if you have open heart surgery, will you wake up with a bra? If not, can they give you a front closing bra? You are not going to be able to put your arms behind your back. And it's going to be really uncomfortable to spin that bra around to the front. And you ladies, you know what I'm talking about, to clip the hook, because you would have just had chest tubes probably, and those incisions are still healing. So ask for front closure bra. If you can't get it, check it out on Amazon. They are not expensive. They are really soft, have snaps. That would be so, so helpful. You should think about bringing some essential oils. And I'm so excited we have Dee Riete coming on to talk about wellness and aromatherapy, because lavender and chamomile, rose and frankincense, they're very calming aromatherapy, not going to be overbearing for any other patients. I will say one of the best aromatherapies you can bring, whether it's oil or another form, is peppermint. Because peppermint, even if you smell minty toothpaste, will should help prevent any kind of bladder urinary paralysis. When you've been cathed, sometimes it takes a long time to urinate after they take a catheter out. So using peppermint oil, smelling toothpaste relaxes the body. I don't know why. Don't ask. I'm not a doctor. I just know what's been tried and true. And it seems to work for some people. I know it's worked for me. 17 surgeries over the years, and I swear by it. I do say pack toiletries because the hospital's razor is going to suck. The hospital's toothpaste is going to suck, and their mouthwash is going to suck, and their deodorant is a wet roller ball, and that's going to be terrible. So bring stuff that would make you feel like remind you of home. You know, some people shower in the hospital after surgery, some don't. So you could always ask somebody to bring you dry shampoo if you feel like you need it. If you're doing, a lot less, if you're not really doing much more than, sponge bathing, you can do that. Cell phone and charger, if you really think there's a chance you're going to use it, more power to you. You're probably not going to want to exert that kind of energy. Find out about visitors, right? Do you want to accept visitors? This is all part of your patient surgical plan. And have that conversation. Don't try to tough it out with pain. If you're not given a PCA or patient controlled analgesia, little button, then have a pain management plan with the nurses, because you don't want to be chasing pain. So don't be afraid to ask for medication. Whatever you want, whatever you've been cleared. It doesn't even have to be a narcotic if you don't want it to be. If you can't do a great job with breathing exercises and the incentive spirometer machine, ask for something to help you do that. Get up and walk whenever you can. It's the best thing for you. It's going to get you out of there the soonest. It really is. As soon as someone says you can sit, you can walk, don't stay in bed. Sit. Even if you're uncomfortable, just stay in the recliner. Try to sit, okay? Somebody once said, do you want pictures of yourself? So if you're somebody that wants to see pictures, memories, videos, I did it because I was creating a documentary. It has yet to be released. Ask people to do that. Okay. If you think that's going to be therapeutic for you. Ask a close friend to provide Facebook updates if you'd like, or create a caringbridge.org. It's free, and it's a great place to invite family and friends to get updates on your progress, because you are not going to want to do it. You're just not going to want to do it. Tell your friends and family that are going to come visit you to bring card games with them and things to keep them busy, because you're going to sleep a lot, right? And they're going to want to help pass the time away. It's a little bit of a distraction. Ask questions about your surgery. And where you are in recovery while you're there, or ask someone to ask, because you're not going to have a very good memory. You're going to be on a lot of medication. So it's okay to ask 2 or 3 times. It's okay to get emotional. It's okay to cry. A lot of times people who have open heart surgery, they cry, they get depression. So anesthesia kind of does that to you, and it's okay. Remember, it's normal. Let's see, potassium. Oh gosh, sometimes our potassium level drops, and getting a replenishment is not pleasant. The pills are huge and taste gross. The liquid tastes disgusting. IV is the easiest way to get it into your system, but it burns a lot. If not the majority of people, it burns your veins. So you want to remember, if you have to have IV potassium, to ask them to push it slowly, to add a lot of saline with it. You're not going anywhere, so you can take your time. Magnesium over time can start to irritate your veins too. So talk to people about that as well. Nurses are amazing. If you're not meshing with someone, it's okay. Ask to switch. Tell the charge nurse you don't want that nurse again. Talk about cardiac rehab. If you don't get prescribed cardiac rehab, ask for PT. Okay, that would be important. If you do not have a recliner or a bed that moves, talk about having your insurance cover, having home health send you a hospital bed. It's the best decision I ever made, ever, because I could finally be comfortable. So that's something to think about. And we've talked about mental health. So check this out. It's under resources. I think you're going to find this list extensive. And again, it's a list created by all of you. So you know it has to be perfect. That's your 2026 pre and post-op surgical suggestions. Okay, so February 22nd, Heart Valve Disease Awareness Day. Hey, listen, awareness is the first step in saving lives. When we listen to the heart and we learn its warnings and act early, we change outcomes. So sometimes awareness just starts with listening, tuning into your body, listening to a doctor, to the inner voice that says something isn't right. And early detection saves lives. Conversations like this saves lives, and sharing this information will save lives, because today on the 22nd, or when you see this yesterday, we stand with the up to 15.3 million Americans that have heart valve disease to shine this light, because early detection, education, and advocacy truly matter. Share this information to spread awareness ASAP, because awareness saves aortas, period. Okay, we are wrapping up this week's weekend review with our events. We have added 2 more events. They're kind of quick. All right, so on the Monday, the 22nd, we have our WISE meeting. This is for women inspiring support and empowerment. It is never too late to join. You just click the link here and it'll take you to a registration form, and you will receive the link this evening, Monday evening, to join that event. We have our last support group meeting of the month, happens on the last Wednesday at 7 p.m. Click the link right there. On Thursday, the 25th, we are working with Aortic athletes. They will be presenting to you. I'm going to butcher her name. This always happens to me. Dr. Coutinho, maybe. She is a cardiologist with the Mayo Clinic, and they will be discussing women and aortic disease and exercise. So interesting, wonderful topic. If you would like to ask questions for the doctor, you must turn them in by the morning of the 24th, okay? And you can send them to info@aortichope.org. And then on Friday, the 26th at 7 p.m., you will see on our Ahtv channel that we are presenting an interview with community member Dee Riete. I don't want to butcher names. She's going to talk about wellness, like 101, and what aromatherapy is all about, because we will begin a series of aromatherapy classes, blending techniques, and blending oils to create a reaction that will help de-stress us, maybe help us sleep, right? These are aromatherapies been around a very, very long time. And we're going to learn how to blend and also incorporate these into soaps. So that might be interesting too. So we have a couple of really exciting things coming up throughout the year, quarterly with Dee. We're going to start off with explaining to you what aromatherapy even is. So tune in 7 p.m. on Thursday, the 25th for the interview with the cardiologist, and on Friday at 7 p.m. for the interview with Dee. And that is our events. And that is our weekend review. So thank you so much for tuning in. We are here every Monday at 3 p.m. sharing the information with you. Do not forget to click like. It makes me feel good. Click subscribe so you're notified every time we go live, so that you don't miss stuff like this. And click share, because a lot of this information will bring knowledge and awareness to the community and to others that are in need of this information. Thank you again so much. I appreciate you watching, and we will talk to you soon. Take care.